Welcome to the Navigating My Crazy podcast. I'm Shayla. Navigating My Crazy is a weekly podcast created for moms trying to balance life, family, purpose, and wanting to improve their mental wellness. Our goal is to inspire conversations necessary to end the stigma associated with mental health and the unrealistic societal expectations related to being a mom. But most importantly, to create a community so that no mom ever feels alone as we all navigate this crazy thing called life together. Let's start this show. So on this episode of the Navigating My Crazy podcast, we want to delve more into birthing options and plans. On episode 10, Disparity in Maternal Health, we discuss options like doulas and birthing plans broadly with nurse Brittany Lewis. But I've had the pleasure of encountering Miss Nikita Johnson, who is a certified OBGYN surgical technologist with over 5 years of extensive experience in education in women's health. She has assisted in over 300 vaginal births with over 150 C-sections at various hospitals. Nikita has a wealth of knowledge concerning feminine health that she readily shares, so I jumped at the chance of having her on the podcast. Welcome to the podcast, Nikita.
Thank you so much for having me. I really appreciate it.
No problem. Thank you for joining. So Nikita's decision to become a labor, delivery, and postpartum doula was based on her very own statement. Working in hospitals, I've seen more maternal mortality and infant mortality cases happen because of too much unnecessary medical intervention or because no one actually listened to the patient. The healthcare worker will focus their attention on medical intervention, while Nikita is able to focus on being your physical, mental, and spiritual support. She believes there is more to labor and delivery than just laying in bed until it's time to push. Deep breathing and meditation will induce a calm and relaxed atmosphere. So spending early labor, relaxing and preparing instead of panicking that causes a mother to feel anxious early on means a longer and more painful labor. So she is enthusiastic about sharing the knowledge that she has. She's certified through the National Black Doula Association founder, Tracy Collins. She's worked in Providence Hospital in Washington, D.C. as a patient care technician on labor and delivery for 2 years. So you provide so much relevant information to women. I know breast cancer awareness. You talk a lot about maternal mental health. You talk about a lot of feminine care issues. So what is a question that you receive a lot of that's not common knowledge to women that you feel women should be educated about?
Well, with me, I worked in various areas of, hospitals, doctors' offices, operating rooms. And one of the main questions that I actually get a lot from women, and especially young women that are even my age or younger, is what is a pap smear? And it breaks my heart because my mother had precancerous cells on her cervix because she took birth control pills for an extended period of time. So what birth control pills does, non-hormonal birth control, is it increases your risk for cervical cancer. So every so often, every 6 months, you're supposed to go back, you're supposed to speak with your doctor, you get a pap smear done, just to make sure that you're within the normal range, making sure that your cervical health is where it should be. A lot of women, even my age, they don't do it. They get birth control, they come in, they want their depot, and you ask them, you're like, when's the last time you had a pap smear? And they're 22, and they're like, I've never had one. Technically, legally, the age is 21 if you're sexually active. If you're not sexually active, but you're still, on some form of birth control, once you become sexually active, then at that point, a pap smear would have to be done. We do see patients who aren't honest with us all the time. They're just like afraid, is it going to hurt? And, I'm just going to be blunt. A pap smear an exam is not going to hurt any more than what it would feel for you to get a phone call to say, we need you to come back in, you have cancer, or there's no way to help you. And then you will wish that you would have taken those steps and just listened to someone. And these doctors, again, they don't force patients. You don't want it, that's fine. And it should not be that way. But the question that I get the most is, I don't know what a pap smear is. What is that? I've never heard of that. I've never known that that was something I had to do. And even when you try to encourage them and say, hey, you don't want to know your status, they still say, is it going to hurt? I mean, it's just fear has overcome our community to where as though their health is no longer important.
Wow, that's true. That's absolutely true. So I know you've been exposed to a lot of prevalent issues over the years, and one you just talked about. But what is something that you feel moms should educate their daughters on that can lead to better feminine health later on in life?
There's a lot. However, what I do know is HPV and herpes are the two sexually transmitted diseases that I see the most. I work for a doctor's office here in Columbia, Maryland. She does strictly GYN, but that's all I see is HPV and herpes. The only thing that I can say is that those are two things that don't go away. It's not gonorrhea. It's not chlamydia. It can't be treated with an antibiotic. Those are two things that do not go away. Use condoms. Please. Please. Right. It's very devastating to have a 13-year-old come in and you have to tell them their test results and they don't understand and they're upset and no, it can't be true. It can trigger a false positive. And trust me, all the Google reviews of, different things about herpes. And, I know a lot of people have questions about that as well, but it's all the same thing, but it's certain viruses that triggers HSV1 and HSV2. HSV1 is a cold sore. HSV2 is a genital herpes. Both can cause one or the other. It doesn't matter. You can have HSV1 and say, oh, I think I have cold sores, but then you get a vaginal outbreak. So just use condoms, be smart, get your children vaccinated. They have an HPV vaccine now. Get them vaccinated. The state health department, especially I know in the city of Baltimore, they specifically have free clinics open where you can just walk right in and get free vaccinations, especially for children. I know adults, they may maybe $3 or $4, but I know for children, they have a program called, I think it's Maryland Healthy or Be More Healthy Babies. I believe that's exactly what it is. And so at that point, that means that all children have free health care no matter what. Find out where they give out free vaccinations. Go to your local health department, get your children vaccinated, but it will pay them out in the long run.
Right. And I know a lot of moms struggle with having those conversations with their daughters about their health, sexual health, feminine health, how to take care of their bodies, those kind of things. Do you have any resources that could help moms with those kind of conversations?
The only thing that I can suggest, in which I've learned throughout my relationship with my 7-year-old, is to just make way for them to talk to you. If they feel like they cannot talk to you, they won't. And it doesn't matter what you do, what you say, what you get them. They'll talk to everyone else except for you. So I really believe if you just establish that relationship with them young, just establish that relationship. And I feel like they'll open up, they'll ask questions, they'll get curious. But if they're afraid to talk to you, they're not going to. And every time you try, it's going to be like tug of war. So that's the only thing that I can say in which I've gone through situations and had to find that out the hard, but that's the best way that I would say.
I agree. My daughter at this point is in college, but I did struggle early on. Thank God. I have an aunt. We had older girls at that time, so I would call her and kind of bounce ideas about conversations with her. And I remember our first conversation about birth control and just the way that I was raised. With my mom, she's like, no birth control, like that's permission to have sex. So just being able to be open-minded so that your kids, like you said, are able to have conversations with you. Because a lot of times if we shut them down and don't allow them to express themselves first, then they're not going to even return for a different conversation. So that's great advice. So let's talk about your profession. So what exactly is a doula?
I'm glad you asked me that. I've been waiting for that question. So a doula is a non-medical professional that provides emotional support, physical support, even sometimes it can be mental support. Just having extra hands, it helps. Now doulas are being able to have a better platform. Tracy Collins is the founder of the National Black Doula Association. She's stationed in Atlanta, Georgia. She was able to create a platform, not just Black doulas, I believe for doulas in general, and pretty much allow us to be able to be heard. And just a few days ago, the Black Doula Association, it's been existing for 2 years now. Pretty much what the Black Doula Association does is it offers trainings, it offers education, and even for those who are in Louisiana, can go onto the doula directory and go right on there and find a doula that's within their area. A great inspiration. Love the owner of the Black Doula Association. She's really a great help. But overall, with her building that platform, we're not just labor and postpartum anymore. We're able to do fertility counseling, fertility support for those who maybe suffered miscarriages or is going through IVF, IUI, or even suffered like a perinatal loss. There's a thing of sibling doula services and bereavement doula services. So things are we're kind of stretching out there, being able to broaden our education and how we inform the communities about things as this. And like I said, with me being on both sides, I work on labor and delivery, I work in a doctor's office. I know that there's a lack of education. And it's not that people don't want to know. They feel like no one cares if they have a question, or they're afraid to ask questions because of the response they may get from the provider. I've seen thousands of reviews at the hospital I work at, and it's just the doctor didn't listen. The doctor didn't listen. But overall, doulas are there to provide you that support when your provider is not there. Like I said, it's more to labor than just laying in a bed waiting to be coached when to push. And, we could get into that for days of how doctors just have control of these births and they don't allow the patient to have an input on how they want their birthing experience. If you ask about getting in water, they're looking at you like, well, what do you mean? There's no such thing. Those things don't exist anymore, when they do. Overall, doulas are there to provide the support, give you that extra encouragement, that education that providers, as they would say, don't have the time to do because they have 50 million patients they have to see, or 3 other patients they have to deliver. They don't have time. So it's a great thing that, the National Black Doula Association was able to have this foundation built for Black doulas, and we be able to reach out into our own community where we're 3 times likely to pass away during birth or after birth than any other race in this country.
And so I know you just touched on a lot of what are some of the benefits if a mom was saying, okay, well, I'm hearing about doulas, I'm not feeling heard by my doctor. What is the benefit of her saying, let me contact a doula?
Doulas have a lot of benefits. One of the benefits is if you are just say you are a mom who had a previous C-section. Your C-section might have just been because you had twins. The doctor didn't feel like you could deliver the twins vaginally for whatever reason. If that mom says, hey, you know what? I only had twins. There was no serious medical conditions. I want to try for a VBAC. Well, a midwife and doulas would be able to support that. A physician will, however, come up with many reasons as to why you should not do that. In the hospital, I know a lot of people know about VBAC, which is a vaginal birth after cesarean, but there's a thing in the hospital called a TOLAC, which is a trial of labor after a cesarean section. So the doctor will allow the patient to have a trial of labor, but if he or she becomes impatient and doesn't think that it's progressing, you're going to go back and get a C-section again. So that's one of the ways that a doula can help, because we can provide that support. We can be there. We can do labor positionings and techniques and, different things to keep you from getting a C-section. And that's the main benefit of having a doula, is the lower C-section rates. And that's just with labor. As far as postpartum, if you are a mom who's had more than one baby, they say the more children that you have, the more difficult it is for your body to heal. You have a little bit more of a bleeding risk. So that's when placenta encapsulation comes into place. That's where we dehydrate the placenta to get all of the bacteria out of it and then encapsulate it. So encapsulation came about because it studies that the placenta, if you put it in a smoothie, it only lasts a certain amount of days. And you have to think about it. It's pretty much like an organ. It's like an organ on the outside of the body. So it's going to do what an organ would do on the outside of the body, which is deteriorate. So it basically cuts your time span to be able to take it. It makes it very short. So with the placenta encapsulation, that increases your breast milk as well. So for moms who are breastfeeding, placenta encapsulation increases your milk supply, and it also decreases the amount of postpartum mood swings that can occur after a mom gives birth. So there's a lot of benefits here that doulas, we have a lot of education that we can provide to the community. It's just the community just have to be willing to learn and want to get involved in their health, because I'm going to be honest with you, these doctors are in it. It's all about money. It's all about money, and it's all about, I go home to my family, I could care less. Right. And you can't get it better from someone. I work right there side by side with them every day.
Absolutely. You know what you said leading into this question, at what point should they reach out to a doula?
If you go to your doctor's appointments and you begin to tell your doctor, hey, this is my first baby, this is my first time, and I can just about tell you the reaction that they get, and it's just like, oh, you'll be fine, you're in good hands. They cut you off because they don't want to know that you know what's going on. They don't want you to question them and for them to have to provide you with answers about your care. So if you go and you begin to share with your doctor, hey, it's okay if I have the fetal monitors hooked on, but, I would like them off, or I don't want noise, or just whatever it is, regardless of whatever you put in your birth plan, you have that right. However, if that physician is not accommodating by it, then you get you some extra support. And I promise you, if you have a doula sitting right beside you, they hate to see us. They hate to see us. When they see us, it's almost like, oh my goodness, why are you here? But they know that we will advise and coach our clients into making sure they know their options and to make the appropriate decisions that best benefits them with their pregnancy.
And so when you start with a patient reaches out to you wanting your services, I'm sure you have to do more of a questionnaire to learn about their history and their expectations, and you kind of teach them about the birthing plan. Is that right?
Yes. So immediately when a client reaches out, the first thing I want to know is, when are you able to sit down and have a consultation? This is not something that we can speak with you over the phone about. I mean, we can, but if you're not seeing, or if we're not in person, you're not going to receive what I'm saying. So the first thing I do is I tell them, hey, let's get you scheduled for an in-person consultation. And then once we move forward to the consultation, at that point, that's when we get, just questions, is this your first baby? Have you experienced a loss? We get that background information. And pretty much we go from there. We go over birthing options, what they want. If they say, hey, I want to deliver with a midwife, I offer referrals and resources on my website where patients can go through the list of midwives that, I actually hold a relationship with, or doctors that I know personally and have worked with in the operating room who are really good patients. I have that information on my website. So at any point, you can go and you can get the information, find the doctor that you want, if you want a midwife, whatever. The resources are there.
So is the expectation that the doula be there for all of the appointments? Do they prep for labor, understanding like what the person's wanting, or if they're experiencing issues?
A lot of times it kind of gets tricky for a doula because technically we don't take the place of a medical professional.
So in our heads, it's an emergency, or we don't know if it's an emergency.
Yeah, exactly.
So you want to reach out to have that contact. So do you find that happens a lot?
It does happen a lot. Quite frankly, I actually had a client call me today. And she's like, I had 3 previous C-sections and they want to cut me again. And I already know that they told me after 2, I'm at risk, but I want to do this home birth thing. I want to do it. I have to still, though I am a doula, I still have medical training and experience. Mm-hmm. One of it is working on labor and delivery as a surgical tech, and that's not safe at all. after
Right.
2 C-sections, when we go in, actually after the first C-section, when we go in for that second time, we have depends on what doctor did your closing, there's a lot of scar tissue. It takes us a lot of time to get to the baby. And if you have an epidural, or even if it's just an emergency or crash C-section, it can go really, really wrong. It can go bad. When she called me, she's just like, I don't know what to do. I said, well, I'll tell you this. I've never met her a day in my life. She just called me and was inquiring about services. And I'm not one who will say, hey, just, schedule a consultation, or, just to get a client.
Right.
That's not what I do. If someone calls me and they sound how they sound, my woman's intuition is going to kick in, and I'm going to be like, what if it was me? And I told her, I said, it would be a risk that a physician would not even sign off on. And we have, with the National Black Doula Association, we have a private Facebook page where we can ask for advice and go and ask these type of questions. And I actually wanted to make sure that I wasn't wrong for informing her or telling her the truth before actually sitting down to have a conversation with her. I mean, and I'm big about that. I don't like to, oh, well, let's just do a consultation. I'm going to be front forward with you. You get what I'm saying? Because that's what we're not seeing with these doctors. We're not seeing consistency. We're not seeing where, hey, they're going to explain this. They're just going to tell you, hey, you got to get a C-section, and then they just expect you to be okay with that. So, when she called me, I gave her my best advice, and, I told her, I said, ask your doctor to refer you to get a pelvic ultrasound to see exactly where her uterine scar is. And if her uterine scar, after being cut on 3 times, is okay and it's not showing that it's by a vessel, they may clear her. However, I'm in the state of Maryland. Maryland is really tough.
Right.
It's not like California. I mean, we don't have it easy up here. It's tough as far as the medical fields. I told her, she could try for maybe a hospital vaginal birth, maybe. The doctor will allow that. And in the event, she could just call me, and if she wants to hire a doula to help her through that, I would be more than great to help her through that. But sometimes you do have to understand that doulas are not able to intervene with every birthing experience. Sometimes, if it's medically necessary, it's medically necessary. It's just certain things we can't change.
Right. And so it seems, just as far as a lot of the work in education that you do, it is heavily involved in the mental health of the mom, which is great because, of course, that's my platform, thinking about moms and mental health. And I've talked to so many moms that experience birth trauma, experience loss. And so we know that affects the mental health of the mom. So your profession is heavily backed by the mental health of the mom, making sure that they're comfortable, making sure that they understand the education. Do you see that helping with the mental health experience during pregnancy and after?
So during pregnancy, of course, they get that reassurance. You've pretty much explained to them from top to bottom what's going to happen. And I do, especially because, like I said, I have different scopes of practice. So literally, I explained to my patient, this is what to expect at 36 weeks, 38, 39. When you deliver, this is what you expect. If in the event you may need a assisted delivery with a vacuum or forceps, these are different ones they can use. I educate my patients. You get what I'm saying? So I don't go in and I don't, just tell you what you want to hear. I'm going to tell you the truth. And I'd rather you be upset at me for scaring you first and then giving you that reassurance, as opposed to giving you that reassurance without even properly explaining to you what could happen if things go wrong.
Right. And that's where a lot of the birthing trauma comes from.
Exactly.
Because like you said, the expectations are unrealistic. You just see these movies with these cute little births or whatever, and everything goes smoothly. Or, of course, we see the traumatic things on television that, of course, can cause anxiety in moms. So just having a balance and understanding in between, if you experience these things that are not on the little, when you're 6 months, a pamphlet. That's kind of what I had. Of course, I had my first kid I had him when I was 18, but I was pregnant when I was 17. So as far as the doula experience, when does it end? So Is it after the birth that you kind of wean off? Is it so many months? I mean, so much time after having the baby that the doula experience ends for the mom?
So typically it can go up to 8 weeks postpartum, but up to 8 weeks, because generally for a C-section patient, it takes up to 8 weeks to recover, and then a vaginal delivery patient is 6 weeks. So typically between 6 to 8 weeks, a doula can be of assistance. I try, even on my website and on my blog, to speak about different aspects of a woman, not just labor, birth, or trying to conceive, or I talk about different things, heavy periods, what can be causing them, non-hormonal birth control that, doesn't have to be given in a form of a pill or an IUD or an injection, to try to keep my moms who, have had babies on their toes, to know like, hey, you've had a baby, but you have to stay on track. You have to keep up with your health. You still have to go get that breast exam. We see patients come in the office all the time and they're like, oh, my baby has Down syndrome and he has a disorder and I'm unable to do this. And it's just like, it takes 2 seconds to go on a website to find yourself childcare. Even if you have to take the baby with you and take someone with you, you go to that appointment and you take care of your health. So I'm trying to really be different, and I'm not sure if you really paid attention to my business name, which is Johnson and Associates, Doula of Women's Health. I'm not just a, doula that just specializes in just labor, birth, and fertility, but I also provide education. And if you want the education, I'm more than happy to offer free sessions to give you that education. And it's because, again, like I said earlier, the lack of the education, people don't know. They come to the doctor's appointments and you tell them what they're getting and they look at you like, why am I getting this? I don't know what this is. Why do I need this? For the most part, doulas are expanding. You have infertility doulas, antepartum doulas, take care of you in the event that you're high risk and have to be on bed rest. I haven't gotten into that yet because, with the labor schedule and having to support a labor client, antepartum is a little different. Right. That's kind of being there every day, one-on-one. But again, anyone who wants to look for a doula, the National Black Doula Association has a directory in all 50 states, resources for doulas in each state.
And that's awesome, the information that you talked about the 6 weeks and the 8 weeks afterwards, because a lot of times after you have the baby, of course, the attention goes on the baby. You have all these doctor's appointments, immunization appointments. If you have a boy, circumcision. So you're constantly talking about the baby. People are constantly calling, asking you about the baby. But a lot of times moms get put to the side. So I think the great part about having a doula is that follow-up where the mom has someone still focused on her while she's focusing on the baby. So I think that experience is awesome.
Exactly. It is. It's really awesome. I can't thank Tracy Collins enough. And I've never met her, but I just knew that when I got into labor and delivery, I knew that I wanted to deliver babies and be a part of women's health. With Maryland, like I said, crazy. They're very limited. There's no certified professional midwife schools here. There's not many resources. You wanted to become a doula. There's not many resources here to be able to do that. You would either have to do an online training or you would have to fly out somewhere to get so we're very, very limited here. And about 6 months ago, I knew that this was my passion, and it kind of came about where it's a very sensitive conversation because labor and delivery is nursing and surgery. And in the event that an emergency takes place and that nurse is not competent, that patient will die. I began to have problems because Hopkins has this reporting system where you type it up, they investigate it, they figure it out, and they go straight to the source. Because I was just a surgical tech, it's like, how dare I? The patient we had, she was dying. She had a C-section. The doctor cut her back open. Blood came pouring out. I mean, like a fountain. She got about six bags of platelets. She got about 4 bags of blood, and she got about 2 bags of crowd. So pretty much her whole body volume was gone. And it bothered me to the point where I'm like, this can't be the hospital. This cannot be. She got confrontational with me once she found out that it was reported, and what you have to, because it was a code and you have to type up everything that happened. So, it can be down for the record. And she came back to me and she was like, how dare you? And it's not that I did anything wrong. And I find that to be the case with doulas. We don't do anything wrong. We're just there for support. And it's almost like if you tell the patient otherwise or you inform them otherwise, they don't like it. I knew at that point I wanted to get into it. However, Maryland does not have the resources that other states have to be able to take a direct entry midwife program and go for 3 years and come out and be a midwife. Mm-hmm. So I really had to sit over the past 6 months and do my research and figure out a way to make this become my reality. With the help of course, God himself, and then this Black woman building a platform for us to be able to do and get the recognition that we need to get, specifically because we're the ones dying. I mean, that's just awesome. And it's just an emotional moment because it's almost like whichever way you turn, it's almost like, and it's almost like you get castrated for telling the truth. Mm-hmm. And even as a doula, that's what we face. That pushback, whether it's from doctors, whether it's from a nurse practitioner, we get that pushback. Right. And it's not fair. I feel like if we had less of that, we would have less deaths happening. But again, it's all coming together.
Right. Back on episode 10, one of the things that we talked about was the disparity in maternal mortality.
Yeah.
And I think the stat said that African American moms are 3 times more likely.
3. Yep. According to the CDC and a few other studies, Black women are 3 times likely to die either during or after childbirth than any other race in the country. And it's funny because they consider the United States a
advanced first world. Yeah.
And they say, it's the safest place to have a baby. And I'm going to be honest with you, it's not. It's actually the scariest place because we've now taken advantage of, I have insurance. I can ask my doctor, hey, can I get an elective induction? Can I get an elective C-section? I don't want to push. I don't want to labor. I don't know what it's like. But you don't realize that these choices can have a major effect on your health overall if things does not plan accordingly. Mm-hmm. I've seen a planned C-section and a baby died. A scheduled C-section, no reason for the C-section, elective C-section, the mom wanted the C-section. For whatever reason, the baby just could not breathe and get herself together and she passed away. We still have to be smart about our health and not put ourselves in situations to where it could possibly cause us to fail. And not get that birthing experience that we deserve or that we know we can have. So just, be smart about it.
Right. And you shared this with me earlier, but I wanted to share with the audience, what are some of the conditions that cause us to lose these moms?
A lot of times it's because of, number one, obesity. No, I take that back. The number one cause in the state of Maryland, in the city of Baltimore, is the lack of health care. Obama did make it easier to obtain insurance. However, if you are pregnant, you don't necessarily get that coverage right away. It's still a process. And within that process, let's backtrack. So an OBGYN office technically does not start scheduling appointments for pregnancy until about 10 weeks, maybe 8 to 10 weeks. People don't understand that the development of the baby more so takes place right after implantation. Those are the critical stages because that's when the baby's brain function and, everything is starting to happen. And so whereas though these doctors are not even allowing the OB patients to make appointments until 8 to 10 weeks. So we're skipping medical diagnosis right there. And then initially when you get your prenatal visit, like pelvic exam, and then they'll draw your labs, STDs, and to check your levels and your fasting levels. But however, if it can be caught sooner, why wait? So a lot of times it's the availability of the physicians, the doctor's office. They don't schedule until a certain period of time. And then at this point, the women become discouraged. You know what, whatever, I'll have a safe pregnancy. I don't have to go to the doctor until I'm like 30 weeks. Then they show up 30 weeks and they find out, oh, you're pre-diabetic or you have preeclampsia. Another thing that I see often is premature babies being born via C-section because the mom had high blood pressure. And that's not good either. Then you're preeclamptic, baby's premature. Stay on top of your health even before you become pregnant. Stay on top of your health. Know your status, because if you don't and you become pregnant and you're like, well, I didn't have these conditions before. Well, you have another human growing inside of you now. So just take care of yourself even after the baby, before the baby. Overall, you need to know your wellness. Don't wait to become pregnant and then you find out you have something and then it ends up having to affect your pregnancy. Whereas though if you would have known before, you could have maybe either done interventions to help or maybe have done some diet changing before actually thinking about becoming pregnant.
And so once a mom finds out that she's a mom and she takes these tests and she finds out that she has preeclampsia, that she's overweight or diabetic or high blood pressure, are there things that she can do to, like a regimen that she should be putting into place, or should she be seeing the doctor more, or is it more on her to take care of things herself?
So if she's preeclamptic, it's pretty much one of two things, either your salt intake or the amount of fluid. And it can be both, because salt intake creates that excess fluid that lingers. So either way, it works hand in hand. It just depends on how bad it actually is. You can have one and not the other, but it could still just be the beginning stages of something. So just watch your salt intake and, try to keep your legs elevated as much as possible. Stay off of your feet. If you're walking more and you're already diagnosed with having preeclampsia, it's just best to stay off your feet as long as possible. But the minute that the provider feels like the baby is at risk, you're getting called in for a C-section, because that doctor is not going to sit and wait for the baby to come and you're preeclamptic. We're looking at another risk that we would have to take. And then if you're preeclamptic, you get a C-section, you're bleeding all over the place. That's another risk for hemorrhage. So guys, please, I can't express this enough. Know your status prior to pregnancy, because little do you know, you can become pregnant and get diagnosed with diabetes even long after the baby's been born. You're stuck with it. So it matters.
Right. And what are some signs after a mom has the baby having some issues and I go to the emergency room? They're just looking at a particular set of symptoms. But in addition to me having preeclampsia or me having high blood pressure, me being pre-diabetic while I'm pregnant, should there be some signs that she's looking for after she has the baby? If she things that she needs to be wary of or make sure she reaches out to her doctor about?
So the first thing is headaches. That's the number one sign, headaches. And usually that's the first instinct. They'll say, oh, I had this headache for like a week and it was terrible. That's usually the first sign that your blood pressure is elevated and you probably need to seek some type of drug medications to help control it. You hear that more than anything. Some people say they feel a little fatigue or they just feel, like they need to eat, when really it's not that they need to eat, it's just their blood pressure is too high. But the most common thing we hear is headaches. Headaches that just won't go away regardless of what they take. Again, keeping it funky. You can go to your OBGYN and say, hey, I got headaches, something's going on. They will give you a referral to get your labs drawn. However, if it comes back elevated, they're going to refer you over to your primary care provider anyway. So then there's money that, you get what I'm saying?
Right.
If it comes back elevated, it's nothing she can do. He or she would have to refer you to a primary care doctor either way. Okay. So it would probably be just best for you to just go to your primary care doctor.
That's good information. As far as the follow-up, just trying to get the information out there of how intervention, whatever we need to do to reduce these rates, because it's scary. It has been really eye-opening in our community, in our state. I think Louisiana was like in the top 3. Yeah, we were pretty high in losses for moms. So, like I said, I want to talk about this as much as possible, just to get the word out to moms locally, across the nation, everywhere, so they know if I experience this, or I should be asking questions, or this pain isn't normal. I would say at any point where it's different than what you normally experience, tell somebody, ask somebody, ask questions, reach out, because it's better to be over cautious than under.
Exactly. And like I said, it's either because they did not listen or they just didn't care enough to listen. And it's usually one or the other. It's either unintentional or just neglect. And I'm not going to sit here and act like neglect doesn't happen. It happens.
It does.
It happens. And it's either one or the other. It's either intentional or unintentional. So, I mean, the one thing that we can do to stop is getting these elective inductions. Elective induction is basically a procedure where the doctor induces you. We're women. We've been around for years, and our bodies know what to do. You don't have to tell our bodies to do anything. It does what it knows that it's supposed to do. Think about it. We ovulate every month. Our cycles are literally every, 28 to 30 days, right on the nose or around that time. Our bodies know what to do. Stop getting these unnecessary procedures done. I also know people wanted to have like the testing done through the belly button. I don't suggest that either unless you carry the gene. I would not suggest it because that can cause a miscarriage. And I've actually suffered a miscarriage at 16 weeks. I, knew what the sex was. So it's very devastating. So just don't put yourself through any unnecessary medical intervention. Stick to what you know. I've even seen 42-weekers born vigorous, crying. They say, well, 40 weeks is the stop, or 41 weeks. I've seen a baby born at 42 weeks. And that strip was the most beautiful strip, which is the fetal monitoring strip that I've ever seen in my life.
Wow.
I've seen 38-weekers not even have a strip such as that. Again, just stop the unnecessary medical intervention. Educate yourself. Stop allowing these doctors to speak for you. Come up with a birth plan. Stick to it. If they don't abide by it, if they will not hear you out, go somewhere to someone who will. Someone somewhere will hear you. Don't settle. Don't think that you have to listen to what they tell you. If it doesn't sound logical, get a second opinion, because you need to know what you're up against in the event that if this doctor wants to do X, Y, and Z, you need to know what you're up against if something goes wrong. And that's the part that these patients don't understand. So that's the best way that I can say to help prevent that. What can you do to the doctors if the patients don't want the education? You can't blame them, So again, we have to get out there and we have to tell each other, we have to know our rights.
If someone wants to find you, wants to get all the information that you have on your website, how do they contact you?
I can be contacted 3 different ways. I have a website. My website is www.doulaofwomenshealth.com. You can briefly go through my website. There's various ways to contact me, whether it's by phone or whether it's by email or text. I do prefer email because I'm also on Facebook as Johnson and Associates Doula of Women's Health. I also have a Facebook group, and I started this group. It's called Women's Health Empowerment. So it's basically a group that I've started where I every week or every few days release health information on there, about heavy periods, fibroids. I know a lot of people come into the doctor's office where I am, and they have fibroids and they have this irregular bleeding, or they're going through menopause, and well, what can I do? So I have all of that information on my website, and actually you can click my blog and you can see where I speak about various titles such as that. Even if you don't want services, just educate yourself. That's what it's there for. It's priceless, free education.
Absolutely, free education. So thank you so much, Nikita, for taking the time to join me. I know you're extremely busy. I see that watch going off. All right. Well, thank you so much for taking the time to join the show. Everybody, again, please look on her website, join the Facebook group, follow her on Facebook, follow her on Instagram, and get lots of information. I was just taken aback by the loads of information that she shares, just that's so beneficial for moms. So everyone take the time to just read up. And then that way you know what you know. But a lot of times we don't know what we don't know. And unfortunately, it can be detrimental. So thank you for what you do. Thank you for being on the show.
No problem. And again, guys, don't forget, National Black Doula Association, Instagram, Facebook. She is wonderful, marvelous. Her soul is precious. And as a matter of fact, she just did an interview in Atlanta, Georgia, in reference to maternal mortality as well. So just educate yourself.
And just to repeat, that name is Tracy Collins of the National Black Doula Association. She's the founder. So I am going to follow her to get more info, being you. And thank you for, following, being obedient and following your calling. So you have a good evening.
All right, you too. Thank you so much.
Thank you for listening to the Navigating My Crazy podcast. Don't forget to send all of your questions to questionswithans@navigatingmycrazy.com, or you can complete the form on our website at navigatingmycrazy.com/contact. Also, join the community and chime in on the conversations by liking and following Navigating My Crazy on Instagram, Facebook, and Twitter. Subscribe and rate us 5 stars on iTunes or your favorite podcasting platform. Moms, have a great week and get ready for our next Talk It Out Tuesday.